everyone, my name is Liana Laughlin and we're back again for another video. For today's video, we will be doing multiple procedures. As you guys know, I had my lips done for about 2 years ago now, and as you can see, there's still some definition left, but now is the perfect time to do some touch-ups. And for today, we will also be fixing my slightly crooked nose. Dr. Contessa will perform nose threads on my nose to align it and make it symmetrical. And lastly, since you guys know I do beauty pageants and I have a beauty pageant coming up soon, it is very important to keep that hourglass figure. So Dr. Contessa will perform meso fat dissolve to dissolve the excess fat I have in my stomach. Kaya don't forget to hit the subscribe button and hit that notification bell to keep you updated.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome back Liana.
Hello.
Yeah, so we did non-surgical nose enhancement for Liana, and in that procedure we were doing like an alignment also, right? So this is now the follow-up of Liana, and we'll check what is now the outcome of that procedure. It was like about 4 months ago, right? We did like a combination of the filler plus threads, okay, to somehow align it. Okay, so actually before we discuss that, I want to ask you, Liana, why choose non-surgical procedures over surgical procedures?
I personally choose non-surgical because there is less risk, and personally for me, I want to embrace my natural features, but just enhancing it.
Correct. Yeah. When they ask me about it, I'm afraid of the knife. I don't want any cutting, and I don't want the general anesthesia. Okay, so it's been 4 months, and actually, we were expecting some tissue buildup already, and somehow the filler and the thread, of course, they're still there. Okay, and so this is now the time whereby we can check how was it. There was already some improvement, right? But a portion of it, specifically on the lower third, the lower dorsum of Liana, we still noticed still a bit of some misalignment. Or Liana was saying like a crooked type of nose, right? But for those type of people, they have this concern of like a crooked nose or a little bit of a deviation there, okay? So did you also like notice still a bit on this lower third of your nose, right?
Yes.
Still a little bit. Yeah, but on the upper part, because before it was so visible, right? So somehow we were able to minimize.
Yes.
And because we haven't really done any follow-up on you because she left for the US. So this is the only time that we'll check on her again and do some touch-ups, okay? Because of course in one treatment, we always like, after we've done the procedure, we tell our clients come back 2 weeks later for us to check again if we still need to do some, touch-ups or additional treatments for that part. Okay, because looking at the radix, somehow it's already improved. And then in the renion part, it's improved. I think that was the part I really worked on. Remember, the radix and the renion part, I worked on that. But this part here, the lower third, this part here. Because if you're gonna look at the camera, if you're gonna really assess, it's still a little bit like deviated. Okay, so Liana, are you ready for another treatment?
I'm ready.
Okay, and in addition to that, actually, we also like did an assessment of her lips. We still wanted to still plump up or volumize further her lips and improve the hydration status, like, because Liana had been flying back and forth how many times in a year. So it's kind of like whenever you have long flights, makes you stress, or like, you know, you lost weight also.
Yeah.
Okay, so we just want to rehydrate and volumize again the lips. So we'll be doing nose enhancement, lip enhancement, and a little bit of like, you know, body contouring using our mesotherapy. Okay, we'll show the procedure when CSA Medical Aesthetics return. And we're back, so we're doing a touch-up of our nose alignment, and also we'll be doing a lip volumization using our dermal filler. So for now, the nose area, okay, initially, okay, you cleanse the skin and then also can apply your topical numbing cream, and you can do your injection of your lidocaine at the tip entry point. And once you inject the lidocaine at the tip entry point, so I did already, there's a blanching there, make your puncture here. You can do it at the infra-tip region, and then I'll be using an intense Bellotero for the nose bridge part, particularly on the distal third. Okay. So fillers I use for the nasal region are high G prime types of dermal filler, hyaluronic filler. So we'll expect some resistance already there. Okay, I'm just gonna glide. So for now, we're just correcting on the dorsal lower third of the nose, so we'll just be up to that point and then push a little bit of my product there. So we're not really doing the entire length of the nose, so we're just working on the distal region, pushing a little bit of my product and going back just to balance it. Okay, and then we're gonna also improve the tip columella. Okay, again, perpendicular towards that anterior nasal septum there. So intercrural space up to the anterior nasal spine, and pushing the product a little bit. Okay, so slow push there until you reach that space, and then we can use our PDO threads or even PCL threads to do our alignment. So this time we'll be using the shorter type of our threads just to improve this distal third of the nose. So I can use like a 40-30 millimeter type of our short threads. Okay, so glide it. We're just reaching the lower half of our nose. So it's our alignment. So since we noticed that this part here is still deviated, entry points can be here if you're doing the distal third, but you can also do an entry point in the renion part. That's another method. So a little bit towards the right side. And last one, then we'll do the tip columella with short threads. Okay. So this is like a 38 millimeter type. And then let's do the tip columella. So entry point, perpendicular, and I'm using a 38 millimeter length kind of thread, and then pinch the columella and glide towards that anterior nasal spine there. We'll be using only 2 pieces here, some discomfort. More, and done. So we did our touch-up of our nose. So we're proceeding to the lip region. So my technique for this one will be cannula method, and will be correcting the lip volume. Actually, Liana still has a good contour of the lips, so the borders are okay. So I just want to improve more of the vermilion body. Okay, so I can make an entry point on the sides. Okay, for my entry point, this part here. Now, cannula method for the lip is not an easy technique actually. So we'll be starting with the upper lip region, and we'll be gliding towards the body of the upper lip right side. Okay, it's not an easy method because you have to really pass through certain soft tissue layers here. Okay, so we have to cross this modulus part here and glide it to the corner of the lip region. So expected to have some resistance because we're passing through a modulus muscle there. Okay, I'm already in the lip body region. So again, I just want to improve the volume, more of the vermilion body. I'm using Restylane Kiss here, and just be doing like a linear retrograde technique. The others are also doing the so-called linear antegrade technique. So I want to also fill in that part of the upper tubercle, the center one. So just minimal dose there. Okay, so looking at the syringe there, so I already placed 0.2, so just a little bit more of the tubercle there, and that's it. Okay, so same entry point, I can work on the lower lip right side. Okay, will improve more of the volume. Okay, just gliding. So take note again, we're passing through the modulus. So I'm now proceeding to the lower lip right side. So I just wanna use 0.25 mil here. Some pressure, Liana. So cannula method is a safe technique in doing your lip filler. So it's blunt, so you're not really injuring any blood vessel, your labial arteries, your labial vessels there. So it's a safe technique. So we want to improve the volume of the lip region. Okay, injecting this part here. Actually, we've done already lip filler injection for Liana in the past, and we did focus on the lip contour, and we were able to make the vermilion borders well defined during that time. So now I'm focusing on vermilion body. So just a bit here on the corner, just to improve further the lip corner. You also place your product there. Okay, so we have used 0.5 already on the right side. So let's proceed to the left. So we'll make an entry point here. Okay, so I'll start with the left upper lip already. So perpendicularly insert the tip of your cannula. So I'm using a gauge 25 cannula, and I'll direct it towards that upper lip. Okay, so for sometimes we go near that corner of the mouth. It depends, case-to-case basis. So again, we're improving volume here. So this is just the cannula method here. So antegrade or retrograde, you can push your filler because it has a lidocaine with it, so it gives numbing of the tissue layer we're injecting the filler. Okay, so again, I'm using my Restylane Kiss. It's made of hyaluronic substance. It's a natural material, and it gives volume. It restores the hydration of the lips. It's for lip contouring, lip enhancement, and lip volumization. You can even do reshaping if you want that like more or rather plumper lips or bigger lips. We can add more, but for Liana, we just wanted something still very natural. Like, right, Liana? Natural lips only. Okay. The others really want that bigger bigger lips, right? Fuller lips, very full lips. But for Liana, we just wanted to keep it simple and natural. And just the right shape of the filler. Just the right volume. Not too much. Okay. Because they say also less is more. Do you agree? Less is more. Okay, so I'll proceed to the lower lip, left side. Okay, so the other videos we did for lip enhancement, we were also correcting lip asymmetry. We were also doing like lip contouring, or making the lips fuller, kissable, or younger looking lips. Okay. Actually, others are asking about like lip threads, PDO threads for the lips. Yeah, we have also done the so-called upper lip border threads. We can also use it at the lower lip border to enhance and or also do contouring of the lips, and also for anti-aging benefit. Because the PDO, as we all know, is also stimulating collagen formation. And this one, hyaluronic, is hydration, restoring volume, and giving that plumpness and healthier, younger looking lips. Okay. So, because with Liana, I noticed that there's some like cracks, or rather like indentations on the lower lip. So, because Liana was always traveling, so she needs to restore that volume again. So hyaluronic is one of the products that you can use to restore the volume of the lips. So it's very safe. The technique is safe. We're using cannula here. We're not really injuring any blood vessels here. And I'm almost done there. So just correcting this corner here. Then after doing your lip filler, you can do massaging of this part here to spread and balance the surface of the lips. Okay, so I have done the non-surgical nose alignment and also lip volumization. We'll show the result to Liana when CSA Medical Aesthetics returns. We're back, so let's now show the result to Liana. Liana, here's our mirror. You can check now the nose region and the lip area, okay? So we did injections on the nose using our dermal filler and those short threads. And then we also did lip enhancement using our Restylane Kiss, the cannula method. Okay, so how was it, Liana?
There's minimal discomfort, but it's tolerable.
Yeah, it's tolerable, right? Yeah. So what do you say about this tip of the nose already? Do you notice the alignment?
It's a big difference.
Yeah,
it's super
big
straight.
difference, exactly. So we focus mainly on the lower third, the distal third of the nasal tip, and also like we use some of those shorter lengths of our PDO threads just to make sure that it's gonna be aligned. And because I noticed it was like deviated to the left side, so like I worked more towards the right to just balance it. And I added a little bit of a filler there to fill in that part that's kind of like sunken there, or like a concave part there. Okay, and also we did the columella also. We added threads there to still project the nasal tip. And then what about the lips? Are you happy with just that simple result? Okay,
I love it actually. Just a little volume.
Keep it natural, right? So we just use the one syringe of our Restylane Kiss, and I've subdivided it like 0.25, 0.25 upper, 0.25, 0.25 lower. Okay, the others who would want really like fuller, bigger lips, they can use 2cc, 2 syringes there. But for Liana, of course, we wanted the face to be proportioned, balanced. You don't want to like too much of this part here, and then the other parts are so small. Yeah. So, well, take note, beauty is harmony, beauty is balance, beauty is symmetry. Hey, thank you so much.
Thank you.
Like we're preparing Liana also like for a big event too. Like of course she's in the some like beauty pageant. There you go. So we're helping her also with body contouring. And our non-surgical body contouring is making use of our mesotherapy, fat dissolving solutions, whereby we inject them in areas where we have stubborn fats, particularly belly areas, especially for women, like in this lower abdomen area, we tend to collect fats there. So we could help you via like injecting also those lipolytic solutions. And at the same time, the non-surgical method, there are devices, like for example, your HIFU ultraformer for the body area. You also have your, for example, lipocavitation, still your radiofrequency. They will still help in giving you that perfect shape for your body, sexier body, okay? Well, physically fit, okay? Because I think during the pageant, like you wear swimsuits, okay? Yes. So you just wanted to have that perfect shape, okay? So thank you, Liana. Thanks again, okay? And if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-139 or 504-4268. Okay, Liana, if they have any questions, can they like follow or message you in your social media account?
You can follow me on Instagram at Laughlin Liana, or in Facebook, my name is Liana Laughlin.
Thank you so much. And she has other episodes, videos at our YouTube channel. Just type Contessa Salvador, and you can also subscribe, and for you to, be updated all the time and check again on what Liana is doing and other treatments that she's doing with us. Okay? Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.